Welcome to Longevity is the New Wellness with me, Will Bozeman. And today we have a wonderful guest with us, Dr. Julie Zafuto, who owns a practice here in the Phoenix Valley. And we'll introduce her in a moment and talk a lot about what she does and her expertise in the fields of health and wellness, and particularly how that relates to longevity. It's a great show today, and there are a number of topics that are of a lot of popular interest in the public right now that you hear about, and I think we'll go over some of those in great detail. Just to remind all of you that you can reach me at willbozeman.com and also on my longevity-based website platform, which is relative.com, relatyv.com. All right. So here we are today with Julie. Do you like to go by Dr. Julie, or do you prefer Dr. Zafuto?
Just Julie.
Just Julie. All right.
Just Julie.
Well, we've known each other for years,
Yes.
and I'm very excited to have you on the show today.
Thank you.
And let's just start out by, why don't you tell us a little about yourself, your past, how you got into the field, and some of your, I guess, if you want to call them your career highlights, whatever you want to talk about to kind of give us your journey.
Okay. So I'm Dr. Julie. Just call me Julie. And I got started in medicine when I was like 4 or 5.
Okay.
Yeah. So from the beginning, I was going to be a doctor. So started giving people shots with needles as a small child, started cutting things and trying to sew them up with needles and thread. Always knew that I was a bona fide healer of sorts. Then went to formal school. I am not, as a disclaimer, not a MD. I am a DNP, so that is a doctoral of nursing practice. So I'm a nurse practitioner with a doctorate. So just to put that out there, because medical doctors do get very angry that we clump ourselves in a category of doctor. So just throw that out there. I did go to school in Seattle for my undergrad, and then I've got multiple different master's degrees as nurse practitioner, and also went to school for my doctorate in the South. So I feel like I'm a Southern belle. Then I came to Arizona and did a lot of trauma work at Good Sam. I don't think it's Good Sam anymore. I think it's Banner University. Have done everything from gastrointestinal to urology to reconstructive plastics to functional medicine, which is what I do now. I got into this space because I was tired of allopathic illness medicine and what I saw it doing to people and utilizing big pharma. And, we're taught in school to utilize big pharma as a modality of healing, which is completely wrong. It is not a modality of healing. It is a modality of keeping you merged with big pharma and supplying them with money and never fixing the problem, just band-aiding the issue. So I got tired of it. And so I sort of went down the path of biohacking. I guess that's a term now. But for me, it was, I got to fix people from the root and figure out what this is and look at things a little bit different and not look at reference ranges like from sick people, but let's look at reference ranges from well people, and they're different. So it's just a different way of looking at people and healing people from the grassroots. And I love it.
Excellent.
It's hard, but I love it. Yeah.
Excellent.
Yeah. Okay.
Well, thank you.
So that's me.
Excellent. And you own a practice here in town.
I do.
I will say the name unless you want to say it first. Go ahead.
The Wellness Method.
The Wellness Method. You're in Tempe, correct?
Correct.
Tempe. Your office is great. Your staff are excellent. And again, I've worked with you and I've known you for several years now. And everyone that I've ever talked to, have been to see you as a patient, have had nothing but rave reviews for you. So you're doing great things, and I appreciate the work you do.
Thank you.
So yes, you mentioned something I was going to point out. The difference between sick care and health care, right? And that's a big topic right now, and that's not what we're here to talk about today particularly, but there is a big difference. And I heard it just recently jokingly referred to as you got a check engine light, and in the traditional sick care model, they are just trying to get the check engine light off. That's like, let me fix that for you, and then they just turn off the check engine. It's treating the symptom, right? And of course, treating a symptom, obviously, there's a great value in relieving of symptoms, but there's an underlying problem, right? There's something that needs to actually fix, and that's what a lot of functional medicine is geared toward, finding out what's the actual underlying issue that's causing the problems, and so that does circle right back around into the whole point of this whole show, this podcast, and the book that I've been working on. It's longevity as the new motivation for people to be healthy and to engage in wellness activities, right? So I mentioned that there's episodes prior to this where I discuss the actual tracking metric that just keeps people motivated, right? If you can actually see some sort of result of your effort in a biologic age reduction format, showing that what the work you're doing today and this month has achieved a certain level of success relating to your life, how long you're going to be able to live, and your health as well. And that's the motivation that keeps people going. And that's really what the whole point of this is about. And it has a lot of its roots and foundation are in this whole world of functional medicine and finding the root cause of illness, but also finding a motivational drive. Because as you know, and most doctors also know, the number one problem is keeping people engaged in their actual recommendations treatment program. Most people just fall off. After a while, they'll try something for a while and they may even have results with it. It doesn't even matter if they're having results. They'll still just quit after a while. Yeah. It's not a habit yet. There's not a motivation that's ongoing for it. And so that's one of the things I believe is going to be very useful with longevity as it's come around into the mainstream public. This concept will help motivate people to stay on a path, on an actual health and wellness plan, which is what you're doing. So like you put people on a health and wellness plan and then help them stay with it. And that's exactly what you and a lot of other practitioners like you are doing. And so I'm hoping that this is a concept that will pick up for not just you, but the patients, that this will be how they actually motivate themselves to keep going. So, yeah. So specifically, we have a number of topics to talk about today. And I asked you ahead of time if you had any particularly exciting things that you're working on in the practice that you want to talk about today. And you did bring up one of the first ones to mind that's become more of a recent application to your practice called methylene blue as a treatment. Would you take a minute to describe what that is, what it's doing?
Okay. So methylene blue has actually been around forever. Back in the day, methylene blue was used to treat malaria and other diseases. We keep it in the hospital so that if somebody comes in with a weird disease, they will get methylene blue. We put methylene blue in lots of things as an additive, similar to EDTA as an additive, but it gets rid of lots of viruses, lots of bacteria, lots of sort of weird things. It fights things on a cellular level. It works to enhance mitochondrial health. And so it's been around for a long time, and it's just coming back into favor now in functional medicine more, being delivered via IV, being delivered through the mucosal membrane, being delivered, I've seen it in a suppository, not my favorite because it can cause damage to the rectal tissue. It's better to be absorbed through the gut. Also now eye drops, ear drops, being utilized with red light therapy to enhance the mitochondrial function or the deliverance through ATP energy through the mitochondria. So people are just using it as an overall wellness and get rid of bacteria, getting rid of viruses, because we're just bombarded. Our whole lives are polluted, basically, through the air, through the water, through our food, as I think a plan to get us all super sick and delving into allopathic medicine and bandages and more pharmaceutical drugs and, on and on and on. So I think methylene blue is only beginning again to be revamped. Back in the day, they would call it voodoo medicine, witch doctor medicine, all sorts of stuff, but it's pretty darn cool.
Well, excellent. Yeah. So mitochondrial dysfunction, yes, or just mitochondrial health in general.
Yes.
That's something that I've been researching quite a bit lately in recent months. Obviously, just a quick recap for all the listeners and watchers out there. The mitochondria is the little organelle inside the cell. And technically, if you're going to go deep into the biotech and biology world, it is a prokaryotic cell inside of a eukaryotic cell, right? So it actually functions quite like a bacteria, but it is inside of our actual cells. And the theory is that it was just basically acquired, eons and eons and eons ago in the chain. So as a method of keeping the energy production inside, right, in-house of the cell. So essentially, it is in the cell, but if you are looking at a chart, and I'll just describe this, if you're looking at a chart of how it works, there's this cascade of reactions occurring in the mitochondria. I mean, it's a chain of events, right? 12 different steps in the chain. Each one of those can become a bottleneck of energy production. Each one of those has an enzyme and an activator effect, some sort of molecule required, right? So a shortage or a deficiency in any one of those can produce this resulting lack of energy. If you don't have the energy in your cell, then your cell can't actually function. If just another step forward with that, I like to use some simple analogies that people are very familiar with, picking stuff up, right? Energy used in lifting a weight, right? Your cells need energy to process the movement of the actual proteins in your muscle, right? If you don't have enough of that actual energy in the form of ATP, then it just doesn't work or wears out, and you just aren't making enough fast enough for your muscle, and then you become fatigued and tired, and then you're done. So that simple little mitochondria is producing energy, and your physical realization is that you're done and you got to sit down, right? Because it can't produce enough energy to keep you standing up and going. So you just have to sit down and rest because you're just worn out. So that's the difference. One of the other previous episodes, I talk about the stress events and how those stress events can be manipulated effectively by us to make ourselves stronger, right? So we can stress our muscles to be able to lift more weight the next time. They don't lift more weight that time. They lift more weight the next time after it heals up. That stress triggers the production of more whatever it is, whether it's more energy, more mitochondria replication, whatever it needs to overcome the stress that it's encountered. Your body, your cells will produce it. And then we go into all the different concepts of that in longevity, because there's a lot of different therapies in longevity that can trigger your cells to act certain ways. And that's being strategically used now to trigger them to act younger and to be younger. And that's the whole concept of what we're doing. But to get back to this, with this mitochondria concept here, is that when you're lifting a weight and you run out of energy, then those muscle cells then are stimulating the mitochondria to actually replicate themselves. And there's a lot of research gone into mitochondrial replication. It needs more energy. It's going to prepare for the next time it's going to be needed. It doesn't want to be stressed like that again. It's dangerous for it. So it says, we'll produce a lot more we'll produce a lot more mitochondria, and we'll produce a lot more energy and be ready for the next event, right? So that's the stress event that has triggered the enhancement of energy production for that cell, right? So that's a good way to think of it. Now, aside from the lifting weights aspect, it applies to all your cells in all your functions, right? So you need that across the board, right? So what happens if you are deficient in one of the particular molecules that's needed to make that energy? Well, then that wearing out process occurs much faster. Like suddenly you just don't have the energy, right? Or the cells can't produce the proteins that they're trying to produce. They can't produce the things that they're trying to make. They can't do stuff, right? And that just actually produces illness, right? That produces all sorts of problems. So going back to methylene blue, there are key molecules in methylene blue that are triggering supplying or triggering the energy production cycle in the mitochondria to actually overcome the bottleneck, to open up the bottleneck, if you will.
Open up the freeway.
Open up the freeway so that the energy can be produced and pour out more abundantly and give the cell all this energy that
Correct.
it needs, right? And so that's what's valuable about it. When people ask, what does it actually do? Well, it's enhancing your mitochondrial function. It's giving you more actual energy for your cells to use, which it just makes everything better and easier, right?
Correct.
And I'll use that example again of lifting weights all the time because it's so easy. Go back to that. Imagine if you just had and 3 times the actual mitochondria function in your muscles that you do right now. Well, then you would immediately recognize that in your ability to lift weights. Right. You'd be so much better, so much faster, more efficient, and heavier weights and all that stuff immediately. And that's the example that I like to use because it's so easy for people to remember when they pick up something heavy. Yeah. So that being said, methylene blue now becomes a longevity therapy,
Correct.
right? It can be used for a regular treatment. What do you think is what do you think is an appropriate regimen of methylene blue? And you're talking mostly in your practice, are you doing IV therapies or are you doing oral or other things?
So it's easier for oral right now. People have to take time out of their day to come in and do an IV. Gotcha. So when you do eye drops, I say every day with a red light. And that's every day. You put them in and you stand in front of a red light and you keep your eyes open. And it, studies show that it really, really improves, and repairs damage to your eyes and that your vision becomes better. People have stopped wearing glasses. So that's incredible. The eardrops, I would say every day. Now, a lot of these are mixed with gold. A lot of them are mixed with silver. So it's not just straight methylene blue. There's lots of adjunctive things mixed in.
Gotcha. And so you're actually talking about the methylene blue and this other stuff in an eye drop.
Correct.
Okay, gotcha. Or in an ear drop. Gotcha.
Correct.
Okay. In addition to red light is what you're talking about. Okay.
Now for ears, red light doesn't really matter, but it is showing improvement in tinnitus. And so many people suffer from tinnitus and it's annoying. So they've got all sorts of holistic treatments out there. Some work, some don't, but from the studies I've seen, this works pretty darn good. IVs, yeah, it's great if you can take time out of your day and come and get an IV. Lots of people are like, well, can you just come to my house? Yeah, we can, but it's messy. If it gets on something, it will stain. And I mean, it stains. So you have to be a little bit careful with that. But I would say the oral version, like in a troche form where you're not doing drops that you're swallowing and it's turning your mouth blue. If you do a troche and you just swallow it and it starts absorbing in the mucal region, that seems to be the best. And I think every day is good.
Okay.
Yeah.
Interesting. Okay.
Yeah.
Have you had, so you're doing this on patients now.
Yep.
Have you seen, have any patients with significant outcomes already?
Yeah.
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 Without obviously revealing any patients, do you have any particular testimonials or any sort of outcomes that they've claimed for them personally? Mostly
enhanced vision.
Okay.
And just an overall feeling of more energy.
Yep.
Yep.
Well, obviously, there you go. Obviously,
powerhouse.
Yeah, the powerhouse. Yes.
Yeah.
Okay. Excellent. Well, that's great. So obviously, that could be a very applicable longevity therapy, something that anyone could add to their regimen of activity.
Yep.
All right. So I wrote down on my list here that there are a few other molecules and products out there that specifically are also targeting, or I guess aiming for that energy production cycle, that are very popular. And you and I have actually talked about those before in the past, and they're actually very popular in the market right now and in the public for what they do. So I'll just list those here. There's one called NAD+. There's another one called NR, and another one called NMN.
Yes.
And so the big question is, what's the difference between all these, right? There's 3 of them out there. What do they all do? And I've been reading up on this quite a bit in the recent years. But yeah, what do they all do? Do you get that question at your office a bit? Because people hear about it?
No,
not really.
People, they just want to feel better.
Gotcha.
So lots of people don't want to know what it does. They just want me to tell them what to do.
Gotcha. They come in and they want to get fixed, right? Like,
Yeah.
help me out here.
Yeah.
Okay, interesting.
Yeah.
So, yeah.
And so a lot of times I'll say, well, we can do an IV of NAD. And they'll say, okay, well, I don't know what NAD is. And I'll say, well, it's nicotinic, da-da-da-da-da. And they'll be like, who? What? I don't understand what this is. And it can be very expensive. And so lots of times people will say, I don't know if I want to do that. Do you have something in a pill form that I can take that might be better? And so a lot of times I'll say, okay, well, we could do NMN, which is the precursor to NAD. And I could be wrong about this, but I thought for a minute that the FDA was trying to take NMN off of the market and it became more difficult to find.
So I think, and now forgive me if I butcher this, because the last thing I read about this, turns out NMN was a designed, the production of that was a designed process that was patented.
Okay.
And so people were basically using that without permission. So I guess it was being manufactured without permission. And it had been developed by a lab. Some of the top voices and minds in the longevity industry have been working on a lot of things, and I believe that was one of them that had been developed in one of these labs. And I guess they just decided that they were going to enforce it, or that the patent had finally cleared and they were able to enforce it.
Gotcha.
But I've heard you can still get it certain places, but I also heard that it's going to be basically brought back to the market through proper channels.
Yeah.
So
I can get it.
You can? Okay, yeah. I've talked to a number of people who said they still take it. You just can't find it. I mean, it used to be on Amazon, easy to find, and now I don't see it there anymore.
Yeah.
And I haven't seen it in very many places at all.
Yeah.
But I'm sure you can still get it on certain avenues of distribution. I'm sure it's out there. But NAD is pretty common, to find. You can get that pretty much everywhere. Yeah. And NR. And I'll read over the names of these real quick. Yeah. I wrote them down so I don't mispronounce them, but I say them all the time and I just refer to them by the initials, right?
Yeah.
But NAD plus is nicotinamide adenine dinucleotide. NR is nicotinamide riboside, and NMN is nicotinamide mononucleotide. Yep. All right. So the differences between all these, it may not matter that much, right? They are all going to perform roughly the same. Yeah. They're chasing out the same outcome. I will say there's probably very significant differences in their biochemical reactions and what they're actually doing. But the ultimate outcome for all of them is to stimulate the mitochondria to produce energy, right?
And to get rid of zombie cells.
Okay.
Yeah.
Well, tell us about. I've never mentioned those or brought those up yet. They're obviously out in the field. People talk about that.
Yeah.
Can you describe what those are?
Sure. So zombie cells, I like to equate it to when you're young, you have all these cells and they're running around and they're doing what they're supposed to do. As we get older, the casing of the shell or the cell is left over after a cell dies. And those are called zombie cells, and they're just sort of floating around and they're wreaking havoc and they're taking up space. So these NAD, NMN, they go in and they sort of eat up or they metabolize the casing or the zombie cell.
Gotcha.
Yeah. So it gives you more room, more space for ATP production, more mitochondria, more cells, more energy. You're not running into a bunch of parked cars.
Gotcha. Okay. Yeah. You know me, I've been in the biotech space for years and years. A while back, there was a kind of a controversy over some of the stem cell products or biotech or biology, biopharmaceuticals, whatnot. Mm-hmm. When people were testing them, they would see cells. Right. And those products should have been dead and inert, but they were seeing cells that looked like they were still whole. So if you didn't actually test metabolism activity, and you were just looking at a picture, you would see cells. Yeah. And you would think those cells are alive.
Correct.
Right. Because if you were going to produce a completely cellular inert product, you wouldn't see the cells or they would be destroyed. Yeah. Right. Is the theory. But then, of course, some people were saying, oh, these are alive. Right. And so they're not. No. And of course, some of the doctors in the field had to come out and put out articles showing, no, these are not alive, and we call them zombie cells. I remember that. So the other zombie cells, they look like they're alive, but they're not. And they're tricking people when they're only looking at images, but they're not looking at actual metabolism and waste products produced from metabolic activity. So again, yes, easy to trick, but in our case now, what you're talking about are basically dead or dying cells that are still in your tissues, which are a really big concept in the field of longevity, right? It's the aging process. Cells start turning off and stop being active. So in a previous episode, I talk about one of the terms that I like to use is cellular retirement. The official term is senescence, cellular senescence. Yes. But even that doesn't quite describe a zombie cell. That's a little bit even more, to the extreme of what that is.
Correct.
Right. But the cellular senescence concept is that it's a cell that has now started to slow down and it starts putting out, this is the dangerous part, it starts putting out signals to let everyone know it is slowing down.
Yeah.
Right. I was like, I'm done. I'm going to slow things down. Yep. My production was at 90% for the last 20 years. Now it's at, 10%. And going forward, I'm not going to do much. When it sends that out, that signal is being picked up by the cells around it. Everything sees that it is slowing down. And the more of that signal you get, the more likely your other cells are to respond to it. So they start to see it, hear it, respond to it, and also start slowing down. And the concept there is that is the progressive aging process of cells slowing down. And so I brought up a concept a few episodes ago called plasmapheresis.
Yes, love it.
It's an interesting. It is very interesting concept. It's I'd say it's still it's in the longevity field.
It is,
and in certain provider realms, it's very popular.
Yes.
To the public at large, seems crazy. They don't understand what's going on.
It's dialysis. Oh my gosh, what are we doing?
Yeah, exactly. They're like, what in the world is this?
Yeah.
But and then of course there's a couple of TV shows where they have promoted the idea that these young
was it Kardashians?
No. I've never seen it. I'm trying to remember it. Again, I'll butcher this. I think it's a show called like Silicon Valley or something like that.
Okay.
Like it's a tech show.
Okay. I've
never seen it, but I've heard people talk about it in other books and podcasts, things like that. And in it, the high end, high rolling tech, executives, they are buying the plasma from these super young healthy guys and having it infused and having their own blood and plasma removed. So they're just replacing it. And so there's a lot of practices out there that are doing that actively. And I just read a book recently and the doctor was talking about how he does that in his practice and has great outcomes. And of course, there's a lot more research going into that now about why that is. And the overall premise is that they are removing a quote unquote, a batch of senescent signals or retirement signals out of the blood, replacing it with active signals. So all the cells start getting a whole new dose of activity. Right. We should be moving and shaking, right? According to what we're reading here in the serum, we should be very, very active right now. And they just turn back on, right? And start becoming more bioactive. And that applies to all of your cells that are producing your regular functionality. So, a regular cell producing energy. It also applies to stem cells. And that was where it gets very, that's where people got excited, is because it's turning back on stem cells. And they are then, turning out and replicating and producing cells to repair damaged tissues. One of the hallmarks of aging is that stem cells are slowing down, because you have stem cells throughout your whole body, in all your tissues.
Even in your urine. And that's why people drink urine.
Oh, I'm not up to date on that one.
Oh yeah.
Okay.
Huge.
Okay. We'll have to talk about that. So I've yet to have anybody bring that up, but you have it throughout your entire body. Stem cells are everywhere to repair the damaged tissue of the current cells that are there. So what happens when the stem cells start slowing down, right? They stop reproducing all the cells that you need. The tissues get older and everything starts slowing down. And that's the aging process. So anything you can do to turn back on that that stem cell is huge, right? And that's what a lot of these therapies are going after. How do we re-engage the stem cells that are present to get them back into action, right? And then, of course, in my field, I've been in the stem cell field for over a decade now, and of course, the other option is to just simply get more stem cells into you, and that's what a lot of people a lot of doctors have been in that for a long time now. We won't go into that whole different world, but it's a very, very exciting field in general that stem cells can be used for a range of treatment options, including potentially longevity and aging. So that's very exciting. But the idea behind a lot of this here, like we're just talking about, is to stimulate cells that are already in your system to turn back on, be more active, and produce more energy. Going back to methylene blue and NAD and NMN, these are all designed to re-engage the cells, get them turned back on, get that energy production going, right?
Make you younger.
Make you younger. Yeah. So with the patients that you've worked on or worked with, helping get the energy levels up, could you maybe give us an overview of what happens to them? How does their life turn around when they engage in these therapies and their energy starts picking up like this? What happens in general, say over the first 4 to 6 months?
Well, I think you have to go back to the beginning when they come to see me. And the reason they come to see me is because they feel like garbage. They can't do what they used to do. Our lives are stressful. They're tired all the time. They're angry. They're frustrated. They're having poor relationships with people. They're out driving and they're super hostile, and everything is just not how they saw their life. So they come to see me, and we first start with a blood panel, and my panel is pretty extensive, and we sort of just go through it, and we see where they're deficient or where the problems lie. And I would tell you that probably 99%, and this is young people, this is middle-aged people, this is old people, it stems from endocrine system and hormones. Everything is broken. And most of it is because we're polluted as a population. We're poisoned through our air, through our water, through our food. We take all sorts of hormone disruptors in our lives. I mean, water bottles are full of them. All the chemicals in fortified foods, preservatives, everything is intended to block, mimic a hormone, get rid of a hormone. I see such young kids who can't produce any hormones at all. We're going to come to the point where people can't reproduce. And that's kind of a scary thing. So in my opinion, we're almost an experiment. We're a lab experiment. And, it's really difficult to think that we're a part of that, but we really are. So my goal and why these are adjunctive therapies, methylene blue, NAD, NMN, all these other longevity things, is to get people back to being able to function. People just don't function. They exist, they don't live. And so having energy is one thing, but having life, that's really the purpose of why I do what I do. Energy is just a component of that.
Right.
People will say, I'm so fat. I can't lose weight. My brain doesn't think. My hair is falling out. My skin is dry. I have no libido. I have no relationship with my partner. I hate my kids. I never sleep. And it's like, so energy, okay, we'll get there.
Right.
Let's just start grassroots and sort of rebuild what we need to do here. Let's do a real good lube, oil, and filter on your car because your service light's been on for years.
Right.
Right? So methylene blue, NAD, all these supplements, all these different therapies, all these different treatments, yeah, they're great, but they're adjunct.
They're adjunct to the primary issue, which is really
fixing the car. Fixing the car. You have no wheels, your engine flew out, and you're on empty, and you're trying to be in the HOV lane. It's not working. It's not working. Your hoopty, your Sanford and Son vehicle needs help.
I love that example. Like everything's broken. You're trying to get in the HOV lane.
Right.
You're right. I mean, Like, I'll be the first person to say I drink a Celsius in the morning and a couple times during the day. I know.
We've talked.
We have talked about that. But you're right. I mean, that's people are using all the stimulants to keep them going through the day.
Correct.
When they really don't need it if they just had the underlying healthy aspect going.
Let's find out why you need that.
Yep.
Will.
Yep. Okay. I need to come in. Just let everybody know. I will be coming in to see her.
And by the way, he is one of my patients.
Yep.
So that's a disclaimer.
Yes. There we go. Yes. I've been in and talked many times, and she's always given me the advice that I'm a classic example of someone who knows what they should be doing and still doesn't do it, at least all the way. I've made quite a few changes in the years.
You have.
Yeah. So,
and you look fantastic, by the way.
Thank you. Appreciate it. Mm-hmm. Yeah. And you've definitely given me all this advice and told me all of these things I need to do. And it's, a lot of it's lifestyle changes, and so again, the typical, I guess the typical medical expectation is that I should be able to take a pill and have the outcome. But a lot of this is all magic. Yeah. A lot of it is lifestyle. It's lifestyle modification. You need to be educated on why, and then you need to be motivated to make the change and do it. Now, again, I've been in healthcare for a while as well. I mean, you're obviously in healthcare in the field of actual practicing on patients, and I don't do that. But I do work with a lot of practices, and we actually in the realm of marketing and patient interaction, we actually have a red, yellow, green categories for the stuff that patients will engage in. So red is stuff that stops a patient, and they will come in and see you for that, right? They put them in their tracks, stop them in their tracks. They'll come in and get that taken care of. Erectile
dysfunction.
I guess, yeah. Well, there you go. I wasn't going to list a whole bunch of stuff, but I'm thinking, so that's one when it comes to like lifestyle, but I'm thinking like my first thought goes to pain. Pain will do it. Pain issues. I'm stopped. I can't. I got to go in and see somebody. I'm in pain, right? That's the red light item. Yellow is stuff that is, I need to get to that, right? It's annoying me, it's bothering me, but I can still work today and I can still go do my stuff today and I'll get to that. And then green stuff is stuff that you just want to do. Like, hey, I'd like to do this. I'd like to, whatever this aesthetic or cosmetic, therapy treatment. I'd like to try this thing. I'd like to do that as a, something that just you want. Not urgent and not necessarily, going to, impact your overall health, but also tends to be the thing that people are willing to actually spend their money on.
Sure. Like on Instagram, as you're scrolling in the middle of the night and you see something, that piques my interest.
Yep.
I better buy it just because.
Just because. Yep. So, but that being said, it's the lifestyle change that people have to make. And again, you'll be the first person to tell people that their diet is the foundation to all of that. And of course, we're not getting into all that today. Sure. But diet is the foundation of all of that. You got to be eating the right things, and the environment you're in. And you've talked about that with me many times. And the like you said, the chemicals that are everywhere. And I go into this in my other company where we do patient education, lifestyle education. They have a whole section on environmental chemicals and things like that. Because like you said, we're all a big experiment. And part of that is because chemicals that they find produce certain outcomes for whatever the case is, production, manufacturing, product development. Hey, great. This chemical works great to achieve this outcome, right? How does that affect humans overall? And the studies that they do for that tend to be, how terribly bad is it right now for a person or for months?
Where's the longevity study of multiple exposure time?
Yes.
Yeah, it's not there.
Then but they need a lifetime to study the lifetime effect, and they don't do that. No. So how do you know how bad it's going to be if you're exposed to it daily for 30 years, right? And they won't know that unless they actually expose people to it for this. So we're in a gigantic experiment, whether it's been intentional or not. And I think a lot of it is not negatively intentional. It's just, we're doing this because this is what makes sense right now. Right. Back in the day, a good one is, canned and processed foods. Yep. I can't remember the name of the book, but he really explained it. He said, canned and processed foods were essential to actually keep people alive when things were tough, right? Spoilage, travel, shipping. I think he said a lot of it stems back to World War II, trying to actually keep the populations fed during really, really stressful times. And that was the only way to get it done. So no one can fault them for finding a way to actually preserve food and actually keep people alive. Well, the next step is, okay, well,
we're not there anymore.
Now do that for 40 years, right? Now what does that look like on a person who's switched their diet from, their own farm-grown produce and their own farm-raised animals to mass manufactured, mass grown, canned, and processed foods.
And hormones.
And the hormones that go in it. Yeah. And, if you look it up, and I've got some great research articles that just kind of describe how that is, but a lot of the preservatives are ester-based, estrogen receptor triggering things. A lot of pollutions in industrial processes are ester-based, compounds, which can, in their current state, they're just a chemical. But when they interact in our system, they replicate and look like, one of the hormones we would make. So it's just an interrupter. And of course, one of the big ones that we've been hearing about for years now is just scents and smells. Yep. Things that smell good.
Candles, plug-ins, sprays.
Yep. All that stuff, we want that stuff in our house. It smells great, in our car, in our house, and everywhere. But that's part of it, right?
Yeah, perfume even, body sprays.
Yep. All that stuff. So it's one thing to have it on you for a little while. It's another thing to have it on you for 30 or 40 years and see what the outcomes are.
Similar to talcum powder.
I guess that's just in the news recently, right?
Yep.
Yeah. Long-term exposure to that's actually not good.
Cancer.
Yep. Exactly. Yep. Yeah. So, and I'm not an expert on that particular topic. I just remember reading about it in the news, right? So same thing. It's just, we're all a big experiment, but one thing we know works really, really well is to eat, as clean of food as you can get.
And as whole of food
as you can get. Right. And I have to preface that because a lot of people get really upset when you start telling them that everything they're eating is bad for them, or that they claim that, it's too hard to do what you're saying. You're making too many requests for changes all at one time. and they just it's the give up effect. You've overwhelmed me with required changes, and now I just want to just give up, right?
Sure. Or that's the American way.
So yes, well, it's in this particular case, it is I've been bombarded with too many things to do all at one time.
And usually that's because their brain isn't functioning quite right, and they get super overwhelmed super quick.
That's true. I guess there's a whole other section on mindset that we talk about. and it goes into that as well. But yeah, I mean, as healthy a food as you can get, as clean a food as you can get.
Yeah. And it's expensive.
And it can be, and that's the other thing is that what you're asking me to do is the expensive route.
Correct. And I've got 5 kids. Yeah. And it's never going to happen.
And it's the time consuming route. I have to prepare all this now.
You do.
Right. So I get that. I've got kids myself, and some days, a lot of days, it's what's the fastest option to get dinner ready for the kids? What is the easiest snack that I can provide them? That is, and this is my argument to everybody, apples and bananas and grapes are actually easier than pretty much everything else.
Yes.
And so I always try and keep that available for them. And whenever they do come across something that they shouldn't have, or is given to them by friends or at a party or at a school function, a bunch of cookies, cakes, and all that kind of stuff, they get mad at me, but I oftentimes say, you can have all that or any of that after you have this.
Do you notice that their behavior is different when they eat that food?
Yeah. If they don't have any real or healthy food in their system and they go straight to the candy and snacks, they get argumentative very quickly. They start picking at each other. I've noticed that for years.
And it's usually because it's fortified with folic acid. And most people, and I think it's 60 to 70%, have a genetic break where they can't process folic acid. They can't break it down into an absorbable folate in their body. It's called the MTHFR gene mutation. And, you fill kids with garbage, people in general, but especially kids in the morning. You send them off to school, and then you get a phone call from the teacher, like, you got to come get this kid. They're out of their mind. Because they can't break down these components, and they literally feel crazy. So
I haven't actually looked into that, but I'm glad you brought that up.
It's huge.
Well, I know with my own kids, some particular foods and candies, things like that, really trigger them to. It's different from being just hyper on sugar.
Yep.
It's almost it changes their.
It's like a different kid.
Yeah, it changes their actual emotional component. Mm-hmm. It's not just being hyper; they're actually hyper and more agitated, right? And they don't like. They can't function.
Correct.
And I've noticed that with them.
Yeah.
They don't do that with apples, grapes, bananas, regular fruit, and anything else that's healthy that might have sugar in it. They don't act that way.
Correct.
So again, lifestyle and changes, right? And that's part of the entire longevity journey because there's a lot of changes that have to be made. Yeah. All right. And of course, we're talking about again here, going back to some of the topics here. There are a number of fixes that can happen, if you will, by coming to see you. First things first, get the blood test done. Yeah. See what's going on. Like you said, most of the time there's probably some sort of hormone issue with the things that they're seeing. Yeah.
And thyroid.
And
thyroid. Everyone thyroid.
Really?
Yeah.
So those are two of the most common things, hormone and thyroid issues, the most common things you see in people. Mm-hmm. Yep. Mm-hmm.
And then diet and inflammation and gut. Leaky gut, bad gut, gross gut.
Yeah. Mm-hmm. Are there any books that you recommend for people on any of this? Well, on gut health in particular, anything like that?
I have so many books.
Yep.
I would have to we can do a link on here for books. There's just a plethora of books, but I will tell you some of my best books go back to things like iodine, why we need iodine, why it was taken out of our diet, why we need to supplement with iodine. We can fix a lot of things just with supplementing with iodine.
Okay.
Another one is the cholesterol myth and everybody who's on a statin drug and what it's actually doing biochemically in their body, making them fat, a lot of visceral fat, making their cholesterol levels are down, but now they're more insulin resistant and their hormones are being disrupted. So you've got somebody who's got great cholesterol and they feel like garbage. So that's another book and there's multiple books on that.
I've actually heard of that exact scenario from a lot of people.
Yeah.
Actually.
Yeah. But everybody who goes into their doctor and their cholesterol is over 200, they want to put them on a statin immediately, and preferably a baby aspirin. So that's sort of the go-to. There's just a ton of books out there. I've vetted a lot of them. A lot of them have good information. So we can actually do a link to your podcast if you'd like, and I can add books on there that people can research themselves or other podcasts that, deep dive things if people want to biohack and go down certain pathways.
I would say too, just to make sure everyone understands too that, probably should have said this at the beginning, but I'll say it now, is that, no one could take what we're taking here as medical advice for themselves, correct, right? They have to come in and talk to you.
They do. They
have to come in and get their blood work done. They have to see what's going on. None of this stuff is going to help you unless you know what's going on internally, right? I mean, some people out there might have some serious issues that are occurring, and they actually need to come in and talk to you about it.
100%.
As a safety precaution, though, everyone should just try and be healthier. Right? Should always try and eat healthier food. I don't think there's any wrong medical advice about just making your diet better.
Stay on the outside of the grocery store. I mean, people have said that for years. Stay out of the middle where all the garbage is that stays there for years.
Stay
go
on
the outside.
There you go.
Stay on the outside. The far less people too.
Less crowded in the produce section, right?
Yep.
I love it.
Yeah.
I think we are running out of time. Is there any other information that you would convey to someone listening to this who's considering what they need to do in their life? What aside from coming in and seeing you, which is what we're telling them to do, come in, see you, get the blood test done, start down the path, get a full evaluation of their health profile. Yeah. And there's going to be a number of things that you're going to recommend for them, and that's great. What could listeners do today? What's a step that they could take today? If you could give them one recommendation to help them move forward in the path, what do you think it should be?
I think it's take a look at what you're putting in your body, putting in your vehicle, whether it's your current supplements or your food. Really look at what they are. So say you are taking a multivitamin. I'll just say Flintstone vitamin. If you look on the back of your vitamins, really deep dive what everything is. If you see cyanocobalamin on the back, which is a form of B12, that actually breaks down into cyanide and a B12 molecule. So garbage. We've been doing it for years. We've been giving it to people for years. So take a look at what you're doing and what you're taking. If you're taking a bunch of Costco supplements, look at their expiration date. How many years out is that expiration date? Where did it come from? How long did it sit in heat? Is it really good? Is it in a gummy form? Just research what you're putting in your body. What's your food fortified with? Does it have folic acid? Does it have bromide? Does it have chlorine, fluoride, all this garbage, stuff in it? Just take a look. You'll be scared.
Be more aware of what you're consuming.
Get your face out of your phone. Look up in the sky. Be aware of what's happening because it's happening to everybody. So I think that would be my best advice.
Thank you.
And then come in and see me.
Come and see you, yes.
Or another functional, whoever.
Yeah, if you're outside the realm of the Phoenix Valley, we definitely want to advise you to find someone else who practices functional medicine as your first step.
I have lots of patients out of state too.
Right.
Because we can do remote and we can get labs other places.
I was just about to say that. I was like, so Dr. Julie can see people from all over the country, right? She's got patients, and I've actually referred people from all over the place to see her. Do a telemed visit. The blood work can actually be sent through her to get to you so she can get everything. So you can still be seen by Dr. Julie from a distance. So,
and we also are, as an adjunct, doing genetic methylation testing in office. We're doing telomere testing, micronutrient testing. We're doing fecal tests to look at microbiomes of guts.
Okay.
So, the list goes on and on.
Excellent.
And on. But
well, that's exactly what we haven't even gotten into half of those things. And that'll be other episodes. We'll talk more about those things. And we'll have to have you on again for sure to talk about those things.
Okay.
And just to let everybody know, we'll put a link to Dr. Julie's practice on the podcast. So you can reach out directly to her. And also, again, you're listening to Longevity is the New Wellness. And you can go to my website, willbozeman.com, and we'll also get you connected to anyone that you need, including Dr. Julie through there as well. And hopefully we can get you on our longevity tracking platform called Relative, RELATYV, which can help you keep track of all your activities and everything in one place. And again, we are so grateful to have you here today.
Thank you.
And appreciate all of your knowledge and insight. And we hope that anyone who's listening can actually make a significant life change and with working with Julie and her team. All right. Thank you so much.